Most women are not happy with their care. Intervention rates are at an all-time high. That would be acceptable if more mums were being saved and more babies were being saved and health outcomes were good. But actually, none of those things are happening.
Mm.
Mums and babies are sicker, mums are more traumatized, and intervention rates are high. Most women aren't traumatized by the pain. Most women are traumatized by the lack of support.
Welcome back to another episode of Squiggly Motherhood. Today's conversation feels really, really important because we're going to be talking about what happens when birth doesn't exactly go to plan and the role that an independent midwife can play in that and why perinatal mental health matters so much. And we'll also be talking about what exactly is an independent midwife as well. So for many women, pregnancy, childbirth can be super empowering. You know, you feel really strong through the experience. But for others, for lots of people, it can feel very overwhelming. It can feel traumatic. It can feel very much like the experience that they wasn't expecting to have. And sometimes the way that our healthcare system is set up, it doesn't always allow women to feel supported, to feel heard, and to really feel like they're getting what they need in their most vulnerable moments. And this is where I think an independent midwife can come in and help advocate for women and for their needs and for what they deserve. So I'm really, really pleased to have Daisy Kelly here today with me, an independent midwife with years of experience within perimental mental health and also supporting women through their most vulnerable moments, which is giving birth and that period afterwards. So she's here to kind of share her experience on supporting women through that birth, through that recovery and beyond, and talk about how we can heal when birth hasn't exactly gone to plan and it's not been what we have hoped for. So welcome to Squiggly
Thank
Motherhood.
you
I'm
so
really
much for having me,
excited.
Nicole. It's
Yeah.
lovely to be here talking about my favourite subject. I could talk about it for hours, so you might have to rein me in a bit.
And I think when we had our initial conversation, we did talk about it for
We did.
hours as well.
We did. We did. We probably talked about it all then. We should have recorded that.
Yeah, yeah. So for those of you who don't know you, can you just give a little bit of an introduction to who you are, what led you
Mm,
into midwifery,
yeah.
what led you into specializing in perinatal mental health,
Mm,
and also what does it mean to be an independent midwife? I think that's probably,
okay.
I'm not sure how many people would know what or would be that familiar with
Yeah,
that term.
sure. Okay, so that's a lot of questions, but
There's a lot of
I will
questions.
start from the beginning. So, as you said, I'm Daisy. I am based in Southeast London, but I cover kind of all of London really, and down into Kent as well, and some of Surrey area. Basically, anywhere sort of an hour and a half from me. Um, and I always was going to be a midwife forever and ever. For as long as I can remember, I had been fascinated by pregnancy and birth, almost to the point of obsession. And if I saw someone who was pregnant, I would just want to know everything about their pregnancy and, just wanted to be immersed in it all the time. So I never had that moment that some midwives describe where they think, oh, this is what I want to do. Or when I had my own babies, I knew, no, it was always what I was going to do. So I did it straight from school, moved away and did my training, absolutely adored my training. It was very, very different to the London hospitals in that in London, most women have a choice of probably at least 3 hospitals within driving distance easily to them.
Yeah.
They can choose probably at least 3. Whereas where I was, everyone went to one hospital because otherwise you were driving 2.5 hours to get there. So it was quite a different experience and I really loved it. Um, Moved back down to London after that, worked at a central London hospital, which at the time had the highest caesarean rate in the country, which was around about 30%.
Oh, wow.
And we're now at sort of 50 pretty much. But that felt a lot at the time.
Yeah.
Um, and then moved to a birth centre, which was wonderful and where I kind of really found myself as a midwife.
Mm.
And then I went and had my first daughter. And there is currently a few little research studies being done about midwives who become mothers and what their experience of motherhood and birth is, because it's it's an area which needs focus, I think. It's a very difficult position to be in, having all the information, navigating your way through pregnancy and motherhood, particularly as a first-time mum. And looking back, I was unwell with my mental health throughout my pregnancy, but didn't acknowledge that at all.
Mm.
Then had a birth that didn't go according to the plans that I had, and struggled to breastfeed, all the things that many first time mums go through. And my mental health was really very poor and I was very unwell. And there wasn't a perinatal mental health service at the time. And so I was managed kind of by the health visitors and the GPs. And they did a really great job with absolutely zero resources.
Mm.
Um, and then I had my second daughter, and after I had my second daughter, a job in perinatal mental health came up. And at the time, the government were investing really quite heavily in perinatal mental health services around about 2015. A report was commissioned looking at perinatal mental health and why we needed to invest in it. And so they were pouring investment into it. And so we were starting to recruit perinatal mental health specialist midwives. And I thought actually that I could really make a difference here. And I could really, what an opportunity to shape a new service. It felt really exciting. So I applied for that job when I was on maternity leave and was offered it. Um, and I just remember coming back from maternity leave and they kind of said, yeah, here you go. Um, and I sort of thought, oh, well, what do you want me to do? And they were like, whatever you want, it's yours, go for it, have fun.
Oh, so there
And
was no kind of structure, so
there was
no structure, no
nothing,
guidance, no, like, a standardized approach as to how you're gonna help these women?
nothing,
Okay.
nothing, nothing. And this service, there weren't these specialist midwives in the country. So there was a few cropping up. So we kind of set up a little network. But even I sort of said, oh, I found this amazing 2-day training course that I want to go on down in Winchester, hosted by this incredible perinatal psychiatrist. Can I take 2 days off work to go and do that? And they were like, yeah, if you want. I mean, you'll have to pay for it yourself, but you can go and do it. So yeah, just kind of set up this service. And for a while, we didn't even have kind of mental health nurses or psychiatrists or anyone to work alongside.
Oh.
So for the first 2 or 3 months of it, there wasn't even that. And then that got made, and I teamed up with them and just really flew with it. I mean, I loved that job. I
Mm.
loved that job. I loved the women that I was working with because there was, and we're going to talk about this, I know, in a lot of detail, Nicole, around continuity. But it was an area I was able to see these women week after week and see the change in them, the positive change, and see them start to heal. Um, that was incredibly rewarding and really wonderful. So I did that for 5 years before eventually moving on into other things. And perinatal mental health is now, I'm not going to say well funded. It's not well funded, but it has some funding, which
Okay.
it needs to have. And thank goodness it does, because women absolutely need to be treated for perinatal mental illness for sure. Um, I'm trying to think, what was the next part of your question? Was it how did I get independent?
Well, it was, what is an independent midwife?
Mm, good question. Very good question. So, an independent midwife, most midwives in the UK are employed by NHS trusts. And in the UK, anyone who is British, who is lucky enough to have been born with the NHS, we are so lucky that actually, we don't have to think about paying for healthcare. And if
Yeah.
we are sick, we go to the GP and we don't even have to think about how much it might cost. And we are incredibly lucky for that reason. Um, but as a result, what's happened is it feels almost alien for lots of people to even consider paying for any kind of healthcare because we haven't ever had to.
Mm.
But we are now getting to a point, not just in maternity care, in lots of aspects of healthcare, where what is being provided is not necessarily good enough universally. Um, and so if you're lucky, you may have a really good experience. But actually, and this is not fear-mongering, this is looking at what women are telling us and what the
Yeah.
reports are telling us, is that most women are not happy with their care.
Mm.
And intervention rates are at an all-time high, and that would be okay, that would be acceptable if more mums were being saved and more babies were being saved and health outcomes were also, high and good. But actually, none of those things are happening.
Mm.
Mums and babies are sicker, mums are more traumatized, and intervention rates are high. And that's for the general population. That's kind of looking at the population as a whole. We know that if we look at certain groups of women, so Black and brown women, for example, their outcomes are significantly worse
Yeah.
than white women. And so we know, and the other report that's really, really influential and cannot be ignored is the Birth Trauma Report that was commissioned by a Conservative MP who was traumatized by her own birth experience, and so commissioned a birth trauma report. And it makes very upsetting, harrowing reading, actually.
Mm.
So, moving on to what an independent midwife is. An independent midwife is a midwife who is self employed. So, she is not employed by any NHS trust. She works outside of the NHS. And so it's kind of private maternity care. But when you say private maternity care, most people think of a private hospital.
Yeah.
And that's not what this is. So anybody can hire an independent midwife. You don't have to be wanting a home birth or a physiological birth. But actually, the majority of women that do hire an IM, an independent midwife, are looking for that kind of experience. And the reason that they are is because we know that that is currently the hardest thing to achieve within the NHS, and that's why they're sourcing it elsewhere. So it's not, if you go into the NHS knowing from day one, I know I want an elective cesarean because I'm very frightened of labour and birth, and that feels like the most appropriate thing for me and my family.
Mm.
Awesome, you've made an informed decision, you won't have any issue getting that. If you go in and say, I'm a first-time mum, I want to have a physiological birth where I'm pretty much left to it unless something crops up, your chances are pretty slim, actually. And so that's why women are realizing, I need to invest in this experience. I actually need to invest. I need to invest not just financially, although that is a big part of it. I need
Mm.
to invest my education in how to get these outcomes. I need to invest in a relationship that's going to assist me in getting this outcome, because we know that the most important thing that an independent midwife offers, and this is absolutely evidence-based through every study that has come out in maternity, that it's that continuity of carer
Yeah.
that provides the safety and provides the outcomes that women want. And we want, my goodness, we want as
Yeah.
well. Um, so I left the NHS about 2 years ago and have been offering for the full continuum of care for just over a year now. So from the right at booking, around about 6, 7, 8 weeks, up until 6 weeks postnatally, and sometimes a bit longer. I just discharged a family today at 7.5 weeks,
Right.
and I've been with them since 6 weeks pregnant, throughout their pregnancy, labour, birth, postnatal period, and it's described as the gold standard of care, and I cannot express how deeply I feel that. And I think the women feel that as well. You are a part of their family and a part of their experience. And that's demonstrated in the outcomes, the
Yeah.
psychological and the physical outcomes.
Yeah, because I can imagine, because you've been with that family for so long, that you would have such a deep relationship with them. And it's not just because what I find sometimes, especially when you're a second time mum, third time mum, you have such little touch points with your midwife, and you may not always come together as like a couple to those appointments as
Yeah,
well. But I can imagine you get to see the family dynamic, how the couples
totally.
work. You have a probably get to see some of the children. You understand them a little bit more on a personal level than you do when you do have go down that NHS route of kind of having those quick midwife appointments. It just feels like such a timely moment to start to have these conversations, because the data out there and the reports, they are harrowing, and the
Mm,
amount of intervention that women
mm,
are having
mm,
is insane. Even just anecdotally with the women that I'm around, or
mm.
that I know, the interventions that they've had, some of the women, they're not even aware of why they've had to have them.
No.
So that education is so missing in that conversation, and I feel really passionately about educating women on their bodies, what
Mm,
happens during birth,
mm,
how and I think a lot of the time people feel really scared when it comes to birth because they've had all these horror stories and this and that. And actually, I would love to get to a place where people feel really empowered when it comes to their
totally.
birth, really empowered with the
Mm,
decisions that they can make,
mhm. Yeah,
or not make, but
mm,
they're coming from an informed place and they know, okay, I'm
absolutely.
saying no to having this epidural. I'm saying yes to having this cesarean because it would work for me and
Absolutely.
my family.
Completely. And what you said, I just want to pick up on what you said about, these women don't even know why they're having these interventions. I don't want anyone to listen to me and think, oh, she's demonizing interventions. That
No,
is not it at all.
no.
What is not acceptable, it's not the intervention that's not acceptable. It's the fact that women are having these interventions either and they don't know why, or either they haven't consented at all, or they have given consent, but 100% it's not informed consent. So they have not been advised of the risk of that intervention.
Can I add another one on as well?
Mm,
Intervention has been put on, but there's been so much fear that they've agreed to it, but there's been so much fear mongering placed that it's almost felt like it's more of a pressured decision. Um,
absolutely.
and talking from
Absolutely.
experience with my eldest, I had gestational diabetes and it was managed through diet, so I wasn't on any medication. But there was so much pressure that I felt
Mm,
and a lot of fear mongering and coming out of, coming out
mm,
from speaking to doctors in tears, thinking I'm not, I don't care about my baby.
yeah.
I
Yeah.
chose to give birth in a birth center with very minimal intervention, and they
Mm,
wanted me to be placed in a ward setting.
with
Um
continuous fetal monitoring.
Yes,
Mm,
and they wanted
yeah.
continuous fetal monitoring, and I was just struggling to understand the reasons as to
Mm,
why when I was like, my blood sugars were totally really good, really
mm,
normal, I managed it, worked really, really hard to manage it well, and because I
mm,
wanted a certain type of
mm,
birth, but got so much pushback on that, and I was really
yeah.
grateful because the midwives really, they really fought and for me
Oh,
and
that's
stuff like that.
great.
But it was a bit of a fight to get
Mm.
there.
And do you know what I find so interesting slash confusing slash insanely frustrating is that so recently I was supporting a pregnant mum who had gestational diabetes, diet controlled as you were. And what we know about well controlled, diet controlled gestational diabetes, these women and babies are at very low risk. Okay. We are not talking about poorly controlled type 1 diabetes with insulin and sugars off the scale. We know that's a different situation. We're not talking about that. And I was getting together lots of information for her. She wasn't a client of mine taking on full care. She just booked me for a one-off session to talk, which is something else we offer as independent midwives, is one-off sessions, two-off sessions to talk about your pregnancy and care that you're having. And I found lots of information for her and highlighted research studies and things.
Mm.
And I found the most recent research studies around well-controlled, diet-controlled DDM were by two doctors who work at my local trust. And it said that there is no need for well controlled gestational diabetic women to have continuous monitoring. It should not be the recommendation. It's not necessary. These babies are at no greater risk of hypoxia. And yet this is not what we're seeing in practice
Yeah.
from these very same individuals, even though they were the ones that completed the research study. And I think you mentioned fear mongering. It's deep rooted fear in professionals as well
Yeah.
of, you know, the one of the considerations that we have to manage in maternity, and it's very difficult to talk about without it being an emotive topic, is to pretty much, 99.9% of women, their baby, their unborn baby or their newborn is the most precious thing, obviously, to all of us. And the idea of anything happening to that baby is unbearable,
Mhm.
unbearably difficult. But as a result, it can be used so easily as a tool to fearmonger. So yes, none of us want to have to think about horrible things happening that may happen. And as a result, if somebody says to you, well, you have a higher chance of something bad happening to your baby if you don't do this.
Yeah.
Most mums are going to say, okay, fine, I'll do it. I'll do it, whatever. I'll do whatever you
Yeah.
say because I want to keep my baby safe. But what we're not being told is, okay, but what is the risk of that you're offering me? Okay, the risk of that you're offering me is that might increase my chance of cesarean. And um, the risks of cesarean are then higher for the baby and also higher for the next baby.
Yeah.
you know so we have to look forward, we have to take that conversation further and push that conversation. But I think because one of the other things where we've lost continuity, both from a midwifery perspective but also from an obstetric perspective. So
Yeah.
women they used to see the same obstetrician for all their pregnancies, and
Mm.
so that obstetrician had a vested interest in her first labor outcome, because he or she knew that, well, in 18 months time I'm going to be seeing her again.
Yeah.
And so I want to make it as good as possible first time, so that second time round she comes in and just pushes the baby out easily. But now nobody sees the same person next time.
Yeah.
So it's not that people care less, but there's less consideration for the subsequent time because it's kind of pushed along the line of not really my problem.
And
Um,
And I guess on that point of like seeing the same person again, do you think that's one of the motivators for why families come and see you? They want that continuation of care, or are there kind of other reasons why women,
so I think
families?
continuity is a big part of it for sure. And I wonder if a lot of the women that I get as clients are second time mums who have had a really horrendous experience first time round. And they've gone in like the vast majority of the UK population do. They've gone into NHS maternity services and they've done a few hours of hypnobirthing or NCT or bump and baby. And I love all three of those things. I
Mm.
think they are all phenomenal. But in most cases, that is no longer enough to educate yourself in
Mm.
how to make decisions for yourself and your baby. Um, and so they go in as a first time mum and have a really, really difficult experience and have felt coerced into decisions that they didn't necessarily want. Joined the dots afterwards and thought, hang on, but if I hadn't done that, perhaps that wouldn't have
Yeah.
happened. And then hire an independent midwife. So a lot of the women that we get as independent midwives are struggling with birth trauma. That's very, very common. Um, and I think first time mums perhaps don't understand the value of continuity of carer, because why would they? They don't, you don't miss what you haven't necessarily had. Having said that, I have had two first time mums this year. And these are just two women who have kind of looked into, well, this is the kind of birth that I want. Actually, one knew she wanted a birth at home and knew that her best chance of getting that was with an independent midwife.
Yeah.
And she had a beautiful birth a few weeks ago. The other one, actually, interestingly, this was such a turning point. Um, well, it was just such a memorable moment and such an emotional moment for me. And I don't actually know if she realizes how emotional it was for me. She was planning to birth in her local birth centre.
Mm.
And my role in that situation is to be a birth supporter, really, be a kind of doula for her. So I go in with her, advocate for her, support her, massage her, all of those things, but I can't act clinically. And she knew that and she was happy with that. And then a few appointments down the line, she said to me, so I've been thinking about it and I'm going to have a home birth because
Okay.
actually the most important thing for me is not where I am, but it's that you're there because you're the person that I have built the relationship with and I trust you to keep me and my baby safe. So I'm going to just do it at home. And if you think we need to go in at any point, then we will. And it hit me. It absolutely hit me like, wow, she's putting of course she's putting such a lot of faith in me, so she should, and I've got the experience and I've got the knowledge and I'm
Mm.
deeply privileged and flattered that women do. But it was just such a wonderful point in our relationship, and she had a phenomenal home birth, and speaks of it so highly, and it was wonderful for me as well. But it was just so lovely to hear her view on birth after we'd worked together for a little while. And
Yeah.
actually, I've had other women do the same. I've had the lady that I discharged today said that when we first met, her plan was to have an induction of labour uh, and an epidural as soon as the induction started because she was so traumatized by the pain from the first time that
Yeah.
she didn't want to experience that ever again. And after weeks and weeks of talking about the birth and talking about the trauma that she had experienced, and her gradually having this really enlightening moment of, do you know what? Maybe it wasn't the pain that was so traumatizing. Maybe it was the fact that I didn't get any support and
Yeah.
I was sat in the corridor for hours and I was repeatedly told I wasn't in labor and my husband couldn't be with me because it was COVID. And, I was repeatedly examined when I didn't really want to be. Maybe it was that was traumatic because when we talked about it further, at no point was it the pain that she was
Yeah.
describing that was traumatic. Most women aren't traumatized by the pain. Most women are traumatized by the lack of support. Even if in their head they've kind of framed it as it was so painful, I couldn't cope. Because we know, I'm not the kind of midwife that says birth isn't painful. We know it's
It definitely is.
intense. Friggin' hurts, man.
Yeah.
You know, but that doesn't mean it has to be traumatic, and it doesn't have to be unbearable or agony. Yeah,
And I guess something that when you was talking about those women and how they kind of, I guess, well, how the first one kind of went from I'm going to give birth from the birth center to then be like, actually, let's go together. We're going to do this at home. And then the second woman, how she was able to realize how actually that lack of support was kind of led into that trauma. I think sometimes when it comes to birth, we almost kind of expect, or when I hear women talk about expect that it's going to be bad,
yeah,
expect that it's like, oh, well, I'm going to go for the epidural, or, oh, well, as soon as I get the pain, like they're linking everything to the pain. And I wonder
yeah,
whether, because so much focus is put on pain management
mm,
and not
mm,
on the support around it,
yeah.
whether that also needs to be brought into the educational piece as well.
Totally. You're absolutely right. And I think there's a risk, and this is in any part of life. We're seeing this horrendously in politics at the moment, but there's a risk where you get this real polarization.
Yeah.
So, we are not saying that it's either, epidural or no pain relief at all. There is there's a happy medium. So we're not saying that if you don't have an epidural, that we can't give you other ways to manage. And that is what it's about. It's about getting through it. It's not about, well, you can take all the pain away, most of the pain away with an epidural if you want to. But if epidural isn't your thing, we can help you find things to help you manage. Because I've had women say, oh, I was a bit disappointed by the gas and air. It didn't take the pain
Take
away.
the edge off, yeah.
Yeah, and it doesn't, and when I really firmly massage your back and do sort of certain techniques to help move the baby off your back or, using the pull, none of them are going to take all the pain away, but they are absolutely going to help you to manage. And I think my lovely first time mum, August client, afterwards, she was a bit shocked and she sort of said, gosh, that was really hard. That was really hard. And she felt quite shocked by it. And I think there is a slight risk with the sort of going down, if you go really polarized into the kind of natural birth community of this, you're going to be ecstatic and you're going to feel on top of the world. And
Mm.
you know what? You're okay to come out of it and go, whoa,
Yeah.
what on earth just happened to me? That
Yeah.
I'm not in a hurry. And she said to me, I am not doing that again anytime soon.
Yeah.
And then I saw her yesterday and she said, I'm starting my personal training again because I want to get my body back so I can do it again. And I thought, hang on, my love, we're 5 weeks down the line.
Yeah.
But
Yeah.
it is totally reasonable to be blown away and not necessarily in an ecstatic way by what your body's just gone through.
Yeah. Oh my gosh. I felt that deeply to my core because I
Okay.
had such different experiences with birthing my first and my second. So with my first, the moment she came out, I gave
Yes.
birth in the birth center. The moment she came out, she was on me and it felt euphoric. I was like, oh
Yeah.
my gosh, it was this high. It felt incredible. Like just I've got such fond memories of it.
Mm.
When I gave birth to my second, And then for context, for my first, the labor was very long. It took like
Okay.
3 days.
Yeah.
Whereas with my second, from the time the contractions were regular to when he was born, it was about 4 hours. So it
Mm.
happened very quickly, very
Yeah.
suddenly. Didn't make it to the hospital and ended up
Mm.
giving birth at home. And my husband delivered him in our living room floor. No paramedics around or anything. And when I think back at it, where I feel very, even to this day, very uncomfortable feelings, conflicted about the birth, is because I didn't feel euphoric afterwards.
Yeah.
I
Yeah.
felt very like tired. Whereas
Mm.
with my first, I felt tired, but I was just very high. I was on a
Mm.
massive high.
Mm.
With my second, I felt very, very tired. I felt very just very out of it, not like ecstatic.
Yeah. Yeah.
And I, for a long time, felt very, very guilty that I didn't have
Mm.
those same
Oh
feelings. The
gosh.
point of like, I don't even to this day, I don't remember the first time seeing him.
Yeah.
My husband said that I gave him a breastfeed. I don't quite
Mm.
remember that.
Mm.
Um, so I wrestle with, and I felt very upset about the fact that I didn't have that elation type
Mhm.
feeling because I was in the Instagram circles
Yes, exactly.
where it was this golden hour and how
Yep.
important it is to have skin to skin and
Yep.
the initial breastfeed. So I didn't have any of that, or I didn't really remember it.
Yeah.
So I then just felt crap that I,
Yeah.
even though the birth, was very straightforward, I didn't have
Mm.
any complications or anything like that.
Yeah.
The fact that we didn't have that connection, or I don't
Mm.
remember that connection,
Mm.
that's what I felt very, very guilty about for
Mm.
a long, 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 long time. And I still feel uncomfortable about talking
Yeah.
about it because, and I also think, oh, but other women have so much work. Like, their experiences would
Yes.
be,
Oh, we're so good at that though,
so much
Nicole,
worse than mine. And
comparing.
yeah, it's very much that
Absolutely. Mm.
comparison.
Yeah.
And
And I think, with any kind of trauma, and we briefly touched on it when we had our initial conversation around, you know, there is a big difference between somebody who has planned to have a free birth without professionals there and somebody who goes through a very rapid labor and births in the way that you did with your husband, who I'm sure was amazing, but that wasn't the plan,
no, we
and
wanted to
you
go to the hospital.
yeah, absolutely. And, you probably didn't feel in control. You probably didn't feel completely safe. You weren't in the place you expected to be. And yes, it was at home and yes, it was uncomplicated, but actually all of that can cause shock. And the fact that you didn't respond in the way that you felt you should, that's word around should, I should and I should and should is so damaging for our kind of our self-esteem and the way that we experience things, because we feel we should do things in a certain way, and social media doesn't help that. And actually normalizing, as we just have done, saying, I actually don't want to hold my baby for a second, I need somebody to hold him for a minute, or
Yeah.
whatever,
Well, that's
is fine.
exactly what happened because, for those who don't know, when you have an unplanned home birth, uh, you call 999, we're on the phone and they walk through how to deliver the baby. But then paramedics come and they bring 2 ambulances because they're not sure whether they're going to need an ambulance for baby and for mum.
Mm,
So 2 ambulances came, 2 paramedics came into the room, 3 men, 1 woman. I immediately got pain relief, thank goodness, because I was in a lot of pain. So I
mm,
got some gas and air. And it when I think back at it, I was just in complete shock. Like I
mm.
genuinely to this day cannot remember what happened what happened afterwards.
Yeah,
I had to get
yeah.
them to like send me some information on a report and like
Mhm,
piece bits together because it was just a complete like
mm,
really fragmented. But we ended up having to go into hospital because we didn't have a midwife couldn't come to the area. My placenta wasn't coming out. When you have an unplanned home birth, they give you a time as to how long they can wait for the placenta to come before bringing you to hospital, and the time is like 20 minutes, 30 minutes,
mm,
very, very short.
mm.
Anyways, ended up being blue lit into hospital. And I remember the paramedic was like, "Do you want to hold your baby?" And I was just like, "No."
Yeah,
And I
yeah,
remember thinking, "Oh, he probably thinks I'm really weird because like what kind of mum, I just gave birth. Why wouldn't I want to like hold my
mm,
newborn baby
mm,
who's literally less than an hour old,
Yeah.
but I was lying there. The placenta was still inside me.
Mm.
My bod, like my womb is contracting. I'm
Of
still in like a
course.
lot of pain.
Yeah. Yeah.
You know, bleeding as well
Yeah.
from a gas of
Yeah.
hair. I was like, I just have no interest in holding this baby.
No.
I just need to get to the hospital to get this placenta
Totally.
out of my body. But I felt again so bad
Mm.
that I wasn't like, "Oh my gosh, let me hold my baby, let me
Yeah.
snuggle up," and
Yeah.
all those feelings. All I could think about was myself, and I just,
Mm.
you know, I still feel guilty about that. I
Mm.
think I
Mm.
should have been more, yeah, wanting to snuggle him. And so it was interesting hearing you talk about, how women, just that expected feeling versus
Mm.
reality.
Yeah.
And I think it
Mm.
took me a long time because I expected all this stuff.
Yeah.
And I put so much value on the golden hour and the
Mm.
initial, skin to skin and all of that, that when it didn't happen the way I thought it was going to, my brain could not cope with it
Yeah, yeah,
at
and
all.
that's your own kind of high expectations of yourself as well. I really don't like it when sort of midwives and professionals say, "Oh, we don't like birth plans because it gives women's high expectations." I think all of that's crap, but we as women put a lot of expectation on ourselves, and actually, your memory of that period is impaired because part of that is normal. Actually, a lot of women who aren't traumatized by birth have a very foggy memory of their labor and birth, and time particularly. They think, I don't know if it was 2 hours or 12 hours, I couldn't tell you.
Yeah,
And that
time
is a
gets so
really
distorted when you're in
yeah,
labour. It's such a
absolutely, and
weird
that's a
feeling.
really normal thing. That's, that conscious brain is switched off to allow your body just to take over and all that oxytocin to do its job. So that, it's a really primal thing. So that is all normal. But the other thing is when you experience a trauma, you do, um experience kind of mental blocks there as well. So you often don't remember big parts of your trauma, and then you get just little flashbacks of it, or little
Mm,
triggers, and that's when it's really difficult because that can be quite unpredictable, and all of a sudden you just are back there, and you
yeah,
hadn't expected to be. So some of your memory will be distorted because that was quite traumatic for you, but some will just be because it was a rapid labor and your frontal brain, your conscious brain was just switched off, and
yeah,
um, and you were probably there still, in the ambulance, and it was a very protective thing for yourself to kind of, no, I just need to preserve myself for the moment. I know that my baby is safe. I know that my baby is not at risk right now. I need to take care of myself. And the other thing I think, Nicole, as well, is it's not at all unusual that your body didn't birth your placenta at that moment. Okay. So
yeah.
the birth of the placenta, your body is aware that the birth of the placenta is a pretty risky time in terms of blood loss, in terms of, if we were giving birth out in the wild, we are only going to give birth to that placenta if we feel completely safe and completely uninhibited, because you have the potential to lose quite a bit of blood at that time. And so, if that process of birth is interrupted by three big burly paramedics coming into your house, and thank goodness they did, but your body doesn't know that,
Yeah.
and going, right, come on, let's do this, let's switch the lights on, let's see what we're doing. Oi, oi, congratulations, love. All of that. Your body's going to go, no,
Yeah.
thanks.
That's exactly what happened. Because they were,
Yeah.
I remember the guy was like, "Oh, I think if we just like massage your belly," and so he started
No,
massaging it to get the
no
placenta out.
way.
Yeah, yeah. He was like, "Oh, I think he said, oh, his wife gave birth, and that's how they got them sent out." So he was there
No.
massaging my belly, and I was
Oh
like,
my
"Oh, this really
gosh, this
hurt."
is not
And I
okay.
just remember thinking, "This placenta's not. Just take me to the hospital now." Oh, and I and
Absolutely.
I didn't realize this. So both labors, I had the injection. Is it oxytocin
Yep.
injection?
Yep.
Just because I didn't want to, but I didn't want to spend. I just wanted it out. I
Yep.
wanted
Yep.
it
Yep.
to be
Yep.
done, and I was like, "Just give me the injection, please. I just want this, like, get this because it hurts." I was like,
Yeah.
let this be done. Let this process be
Mm.
wrapped up." But paramedics can't give you that unless it's an emergency where
Yeah.
you have been bleeding out.
Yeah.
And I was like,
You're absolutely right that they don't give that injection unless there's a bleeding, but then they really, really shouldn't be. What we used to, I don't know if the term still exists, but when I was training, we used to call it fundus fiddling. So that the top of your uterus is called your fundus.
hmm,
And they would always say, don't fundus fiddle. because it will cause bleeding. So they should not have been fundus
Oh,
fiddling.
oh,
No
really?
way.
Help me.
Leave it. Oh, absolutely.
Oh, okay.
Do not touch it.
And I think this is something else that we spoke about when we had our initial intro call, was that it could have been the first time they've seen
Well,
birth.
100%.
So and
100%.
that's the thing with the, and I think certain things happen with the paramedics that I wasn't 100% happy with, but I also have to recognize I don't, like, they came in with panic energy because they didn't know what was going on.
Completely.
And secondly, and which is, it could have been, things could have gone
Mm,
completely south.
mm.
Like, I understand that completely. But then also they themselves may never have seen anybody give birth. So they're walking in thinking, oh, I don't know what to
Yeah.
do here. I think
Yeah.
touch the stomach, that feels about right.
Yeah. Yeah. Yeah.
That will push out the placenta.
You're
Um,
completely right, Nicole. And I really have to check myself and say the same thing to myself around Daisy, cut them some slack. You have seen thousands of babies be born. They may have seen two.
yeah.
Or one, or maybe even none. Let's just be a bit kind. So, yeah, you're very insightful of you to kind of acknowledge that for sure.
Super quick interruption. If you are enjoying this episode and you think someone would benefit from it, please, please, please share with a friend and don't forget to subscribe. Now back to the episode. So I don't think I would necessarily class my birth as being traumatic, but for other women out there who have had a traumatic birth, how do they get to a place of healing and acceptance?
Mm. It's a really, really good question. And it's a really important question as well, because we know how prevalent birth trauma is. And I think your experience is a really good example of, and we won't go into depth with yours because that's not what I'm here to do, but I wonder if you're not prepared to describe yours as traumatic because yours wasn't as bad as some other women's, and so you don't deserve to have the trauma. I don't know. I don't know.
That's
That's
definitely
yours to
that's definitely
unpack.
some of it. That's definitely some of it. Yeah.
Yeah. Yeah. But I mean, the first thing to do would be to, get through those first few weeks and really address kind of how you are during those first few weeks. So no one goes through those first few weeks post birth and thinks this is super easy. Like, I'm loving this. It's really hard for everybody those first few weeks. But if those first few weeks are complicated by trauma, they're going to look different. And they're not necessarily always the same. Trauma doesn't present the same in everybody, but often there's a hypervigilance. So most women anyway will be concerned about their baby and, checking that they're breathing and doing all of those things that new mums do. But hypervigilance is a state of, that you and the baby and potentially other people around you as well your lives are constantly at risk. And that's an exhausting place to be. That's an exhausting way to live your life, that you're constantly on edge that something dreadful is going to happen to one or both of you or all of you in the
Mm.
family. And it may be that is kind of anxiety. It may be that actually leads to an OCD. If it is that those thoughts start to lead to behaviors. So, only I can hold my baby because it might be that somebody else drops them, or we actually don't leave the house because we might get hit by a car, and that then becomes an OCD type presentation. So the first thing to do would be to address really whether what you are experiencing is the normal, hard first few weeks. Oh my gosh, this is really tough. All of that. Or actually, is there more to this than just that?
Mm.
And it's not just up to the woman to recognize that, because very often it isn't the woman that recognizes that. Really often, certainly in my situation, it wasn't me that recognized that I was very unwell. It's very often the person around you. And that may be the partner, it may be the mum, it may be, again, oh my gosh, I'm so boring talking about it. But if you've got continuity of midwifery carer and you've got that same person coming in and she can go, do you know what? This is not the same woman that I was looking after a
Yeah.
few weeks ago, and I'm actually really concerned. And that's where that comes in as well. Having said that, I'm just going to give a moment's kudos to NHS community midwives, because they will very often pick up that somebody is not well based on 10 minutes of meeting them.
Yeah.
And that is not easy. That is really not easy to do. So hats off to them for being able to do that and for being able to navigate a system where the women aren't necessarily getting the support that they need. So I think the first thing to answer your question would be to recognize that actually this is something a little bit more. And then have the people around her be as kind as possible in terms of self-care. So making sure that she's eating and drinking really well, making sure she's getting the bath or the shower that she needs to have once or twice a day, making sure that everyone's being really gentle with her and not saying, no one helpful around her going, well, if you just had a C-section in the first place, this would have been awful things like that. Or,
Yeah.
well, I mean, we've all heard it and we've probably even all said it at times, but please don't say it. Well, at least you've got a healthy baby. At least you and
Yeah.
your baby are okay. That's not that's not okay, because it just absolutely minimizes her trauma. And Nicole, again, going back to you, you're almost doing that to yourself, aren't you? With,
Yeah.
well, me and my baby are fine and we had a straightforward experience. And I'm not trying to make you traumatized. I'm not saying please be traumatized. But at the same time, we do diminish our own experience
Yeah.
by looking at others, don't we?
Well, 100%, because of how it happened, and a lot of people said to me, "Oh my gosh," well, two things. A lot of people said, "Oh, you must have been so scared," and actually,
Mm.
I wasn't. I was just
Oh,
so
good.
focused on getting this baby out and having the pain stop. So I wasn't
Mm.
really. I don't know. When I'm in labour, I just don't have any. I don't know. I'm in another place, so I
Yeah,
wasn't really
great.
focused on that. Um, so I think it, because people felt like I would have been scared during the laboring, I think then it's hard to kind of say my challenges were afterwards when baby and I were fine. And
Mm.
again, there was a lot of comments around, oh, but you guys are fine. Like, oh my gosh, like you gave birth at home, no one was there and you're both okay.
Mm.
So I then felt a bit embarrassed to then say,
Mm.
actually, I really very much struggled during that postpartum. So a lot of people who saw me and everything came around the house would
Mm.
never have known that
Mm.
I was really upset, like tears and stuff. 'Cause I just felt like it was just really embarrassed.
Mm. Mm. And that those feelings weren't justifiable.
100%,
Mm.
100%. It's like, "Oh, how
Mm.
can I be upset I didn't have skin to skin?" Like, even now, I'm like, "That's just so silly." Or how can I be upset that I don't remember the first time, or that initial kind of half an hour, 45 minutes is just very, very fragmented.
Mm.
Or my husband's had to, like, fill in a lot of the gaps, and my mum was there as well, because she was looking after my eldest, but, like, I had people filling in the gaps, like, how do you explain that that doesn't sit right with me, the lack
Mm.
of
Mm.
I just don't remember it.
Yeah.
It's just, and
Yeah.
as you said something earlier around it would come back to you in pieces, and yeah,
Mm.
over that postpartum period, over probably a good few months, maybe like 3 or 4 months, I'd just get
Mm.
random flashbacks or random
Yeah.
bits of information coming in,
Yeah.
and so I was able to use that to help piece it together, but it's how do you
Mm.
explain to someone that that is upsetting?
Mm.
Because
Well,
everything was
firstly, I
fine.
think you don't need, firstly, it's taking away that sense that you have to be able to explain it because you actually don't owe that to anybody.
Mm,
And if you don't want to explain it to anybody, you do not have to explain it to anybody. If you feel it would be helpful to, then you pick wisely who
yeah.
you explain it to, because we all know those people in our lives where you think, oh God, I'm not going to tell them because I know exactly what they're going to say.
Yeah.
Um, and we are fortunate now that perinatal services exist. And so I think for that woman that kind of fictitious woman that we were talking about, who is starting to experience those feelings of trauma, whether that be through hypervigilance, tearfulness, not sleeping, oversleeping, all of those different things that
Mm.
can present flashbacks. Um, Seeking out perinatal services is really, really important. So speaking to the GP, speaking to the community midwife, the health visitor, even your partner or your mum, and just saying, look, I think I need to get some help. Now, what we know is that perinatal services exist now since 2015. And thank goodness that they do. But having said that, the threshold is still very high. And so most women won't meet threshold for perinatal services.
Okay.
It's sort of the top 5% of kind of need will be able to access them. Um, and so for most of those women, a bit, like what we were saying with kind of independent midwifery, they will need to pay privately for that. And there are different costs to that. So you could go with kind of a counsellor, for example, a perinatal counsellor who would be really highly qualified and brilliant, I'm sure. Or you can go really, much further down the line and go with a clinical psychologist or psychotherapist. And it would be worth looking at what treatments they provide. And
Mm.
also, seeing how your relationship is with that person. Um, a lot of women, and this is completely understandable, a lot of women don't feel ready to do that for quite a long time because they're really busy with their baby. They find it really difficult to think about, let alone talk about at
Yeah.
length. And actually, it's psychologically easier for them just to go, well, I never need to think about that again for a while. I'm going to shut that away. Let's not think about it. Let's carry on with life. So the time when I would usually see those women, inevitably, was 2 years later. They find out they're pregnant and they think, holy crap, I've got to do all that again.
Yeah.
And it all gets opened up. So if possible, it's better to address it before that point.
Mm.
Um, but that's not realistic for a lot of women, and a lot of women will wait until the beginning of their subsequent pregnancy before addressing it. But that is okay as long as you do, and you don't wait kind of until sort of 38-ish weeks, because then you haven't got very long to work on it.
No.
Um, and in terms of treatment options, psychotherapy, psychology, counselling, CBT therapy can be helpful for some women. There's a type of trauma therapy called EMDR, which came
Mm.
from treating soldiers with PTSD and is now used really widely for lots of people with PTSD. And that can be used really safely as well. Um, what I will say, and I know this isn't helpful for lots of women, but I have a client who was deeply anxious about her labour and birth. The one who felt that she'd been traumatized by the pain. And she had some counselling in her pregnancy. And actually, the most healing thing for her, and this is what most women will say, is that subsequent birth that isn't traumatic.
Yeah.
And realizing that, oh, okay, I can do it. And it doesn't have to be horrendous.
Yeah.
And actually, this client that I'm talking about, every postnatal appointment we've had, she's wanted to relive her birth through talking about it.
Mm.
Um, in a really lovely way. So not in a, I need to dwell on it, I need to have flashbacks to it. But she's like, oh, and remember when I moved my leg in this way and then you could see the
Yeah.
head, and remember when I said this, and wasn't that amazing? Oh my
Yeah.
gosh, then the baby just came, and it's just, I said to her today, how is your mood? Because I was discharging her today and I always ask about their mood. And she said, I can't even compare to last time. She said it's just night and day, the
Wow.
difference. And I think for so many women, that second birth can be so deeply healing. And not that psychotherapy and psychology isn't helpful, because it's essential for lots of women. But
Mm.
actually, often it's not until a subsequent birth that healing really starts to kind of really take off.
Yeah, and I can totally understand how how a subsequent birth would be healing.
Mm,
And
mm,
how it would make you almost feel like, yeah, I can do this, and it doesn't like this is a different kind of experience, and your memory of it is changed. Your memory of
mm,
birth is
mm.
something new and different.
And your narrative about yourself as well.
Yeah.
So for a lot of women, that birth trauma has really embedded a sense of failure in them. Whether that be that my body didn't do it, or I should have spoken up more, or why didn't I do this, or whatever it might be. And actually, they're able to change their sense of self slightly after a
Yeah.
more empowered birth. But I was just going to say, actually, for women that don't then have a subsequent birth, it's very possible to get to a point of healing as well. So I had very significant birth trauma after my first baby, and I didn't experience birth trauma second and third time round, but I also didn't experience kind of hugely positive birth either. None of my babies were born vaginally. And for me, what changed so hugely, I had a huge amount of psychological support from an amazing psychotherapist and EMDR. And what has changed for me is that I can talk about it now without being upset.
Yeah.
I and I feel sad about that I never birthed a baby vaginally, and I feel sad that I haven't had that experience, and I feel sad for loads of different reasons that I could get into in depth, but I don't think it would be helpful. But I don't feel traumatized now. And I
Mm.
think as a culture, we are not great at accepting and being comfortable with sadness.
Oh,
So
yes.
I am so I am so okay with the fact that I will always be sad that I didn't birth my babies vaginally. And I don't need anybody to go, oh, but Daisy, they're healthy. Oh, but Daisy, you're lucky you didn't have a tear. Oh, but you've protected your pelvic floor. Whatever people might want to say to women who are, you're trying to pacify somebody.
Yeah.
I don't need you to do that because I am okay with feeling really sad about this. But what we shouldn't feel is constantly traumatized, constantly on edge, constantly sobbing about it. I'm none of those things. So it's okay if you don't feel ecstatic and wonderful and on a high about your births, because I don't. But I don't feel traumatized by them.
Yeah. I what a beautiful way to say it. Because I agree. As a society, as a culture, we have an issue with being sad. I
Yeah.
can't get my mind around it. I think it's so bizarre, because I think I'm so much, and maybe it's because I'm in therapy, so I feel like I sit with a lot of sadness and uncomfortability. I'm more comfortable with those types of feelings.
Mm.
But I always find it interesting when you say something that is sad, how quick people are to be like, "Oh, no,
Oh,
no, 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 but this, oh, but that." And it's like, no, but I feel quite comfortable with the fact that I
mm.
am sad
That's
in it.
their discomfort.
It is their discomfort, yeah.
Mm.
Um, and I always find it fascinating. It's like, "Oh, no, no, but I'm actually really happy to sit in a bit of sadness right now." I'm not sitting in it for
To
days
be
and months.
melancholy and yeah.
Yeah, yeah, it's not even that. It's just, but I have an awareness that this makes me feel really
Mm.
sad. And
And
that,
how vital is that for our children as well?
oh,
Because, you know, if they come home from school and they're 4 years old and this person took their toy and, they feel sad about it. And to us, so many of us would want to go, oh, but that's silly. You can just get
mm,
another toy or whatever. But actually, no, let's validate. They feel really sad about that. And let's sit with that feeling of sadness and let's manage that feeling of sadness and know that that feeling of sadness is not going to harm you.
yeah.
And actually we can be comfortable with that, and we can be resilient. And I'm really unsure about the word resilient, because I don't ever want it to, it's used so much in midwifery to diminish midwives' trauma. You're
Mm,
just not resilient enough. And that's not what I mean at all. What I mean is our nervous system has the ability to manage sadness. Let's not underestimate our nervous system. We can manage sadness and also still be a very well-rounded, not depressed person.
yeah, I totally agree with you.
Mm.
I would like to move the conversation on slightly, and I think
Mhm.
it's really important that, especially me as a Black woman, I think it's really
Yeah.
important to touch on the facts, and the data around there that kind of says that Black women are 4 times more likely to die during childbirth or during
Yeah.
pregnancy.
Yeah.
Um, and I remember actually when I first heard about that stat, I think it was back in 2020, it was actually, I think it was 5 times more likely. So
Yeah, it was
the numbers have reduced, but I mean,
minimally.
still, it's, yeah, minimally, it's still a horrific figure, and that is, 4 times more likely to die in childbirth or in pregnancy compared to their white counterparts. I just want to add that bit
Absolutely.
in as well. And also another stat that I just want to add in is that they're also 6 times more likely to face complications such as preeclampsia, and they're disproportionately have higher rates for stillbirth as well.
Mm.
As a Black woman, having, when I was in labor or when I was found out I was pregnant, being aware of those stats, it's like petrified, like really, really
Yeah, I
scared, like
cannot even
really
imagine.
scary.
Mm.
And just really feeling like it just feels unsafe from the get-go, and being really
Completely.
nervous around the care that I was gonna receive,
Mm.
and just being really, yeah, just really unsure, and knowing that I had to advocate for myself, but then also not knowing how on earth I was gonna do that when I'm in labour, having never laboured
Completely.
before, and not,
Oh,
you know, like, what does that
as
mean,
if it's
you know?
not daunting enough that you've
Yeah,
then got
exactly,
this layer.
exactly. Another thing to think about. Um, so I guess, what's your kind, and this is a very open-ended question.
Yeah.
You
No,
know,
I hear you.
what's your thoughts on that? Kind of how can, you know, you know, do Black women, are they forced more to kind of see independent midwives? I guess, what kind of
Mm.
advice can you give to
I
those
mean,
women now who are
that's
pregnant?
a really good point, and I think, um, I've only had a kind of just over a year of clients, and I haven't had any, Black clients, and I don't know why that is.
Mm,
Um, Again, the answer, the safety for Black women should be no different for white women, in that, we know that continuity is what's going to provide the greatest level of safety. And so for a little while, what the NHS were offering, and they may be offering this in certain areas, of the UK still, but I can only speak about my local areas. I know that, Black and brown women were put into caseloading teams. So basically, they were given continuity of carer, because, as we know, equality is not about everybody having the same. It's
no,
about everybody, trying to achieve safe outcomes, and however they get to that is what we should be doing. And clearly, care is not equitable. Very clearly, it's not equitable. Otherwise, we would have equitable outcomes, which we do not. But that seems to have gone as well. That layer of continuity. I mean,
mm,
what I would say for Black and brown women going into maternity services who are not going down an independent route, because you shouldn't have to.
yeah,
I hate the fact that women have to pay for this care. But I think, really, and I even hate that I'm going to say that women, should be doing this, because they shouldn't have to. But I think it would be totally reasonable to go to your midwife appointment and say, what is this trust doing for Black and brown women to ensure safe outcomes? And I think those midwives should be able to advise you really confidently, um, and really professionally about, well, this is what we're doing at this trust, and
yeah,
these are our outcomes, and we are really proud of this. Um, and if they aren't able to, I think we need to be looking at why they're not able
mm,
to. There is, every local trust has something called a, MNVP, a Maternity and Neonatal Voices Partnership. And when I describe it to women, I say it's a bit like a PTA, but for hospitals.
mm,
So it's a kind of a group of service users, midwives, doctors, whatever, who all collaborate on improving services. And there needs to be a kind of project panel on each MNVP for Black and brown women, to look at actually what is our trust doing to improve outcomes for these women, to ensure that their voices are heard. Um, I think also, in all honesty, it's a massive. There's been a massive exposure across medicine in general. This is not just maternity services, and my goodness, that is not me justifying this. This is
mm,
saying this is shocking in every aspect, insofar as, you pick up a medical textbook and it's all white bodies.
yeah,
And when I learnt about neonatal jaundice, it's all about looking at yellowing of the skin. And actually, we never learnt about how to identify that in Black and brown babies,
yeah,
or, all of these things that shouldn't be the case. And therefore, there is a racial bias, because we are not, we are not skilled and competent in
mm,
differences. But there is some really amazing work being done. There's a guy, and I wish I had revised his name before I came on, but he was a medical student. I'm sure he's now a doctor. And he has spent a lot of time looking at dermatological conditions and loads of other conditions. How does it look on Black and brown people, and
yeah,
how does it present? And that's vital. And we need to just embed it into the curriculum, completely. But the other charity that I have to, and the other, people that I have to shout out are Five Times More, which
yeah,
is a charity called Five Times More. And those women are absolute powerhouses, and they have done so much, to progress the care, to kind of try and reach some kind of equitable state. Um, I'm not sure I've answered your question, Nicole, but I'm also not sure. Like you said, the question was very open, but
Yeah.
I think it's completely reasonable for Black and brown women to feel very frightened of the stats at the moment, and I would as well. And I think being absolutely open with the maternity services and saying, "What are you guys doing about this?"
Yeah.
Is reasonable. And obviously, contact independent midwives. We are here for you. We want to hear from you for sure.
I know 5 times more, and they have done a lot of work to move things forward, to get legislations put in place, to just really apply that pressure
Mm,
for
mm,
change. And so we will link their website in the show notes, because I
mm.
believe they do have information on if you are a woman and you are pregnant and you are Black or brown, the, this is how you can get some support. You know,
Yes,
these are the things that you can be doing. This is how you could advocate for yourself, have a voice for yourself. And they've also teamed up with the Tommy's
yes.
charity as well, that supports women who have experienced a loss or who are
Mm,
going through the
mm.
pregnancy journey. And there's a route there for women, black and brown women, to get additional kind of support as well, kind of having one-on-one conversations with a midwife as well, because the stats are horrendous and they're
Yeah,
scary, and
yeah.
clearly women are not getting the support that they
Mm,
need.
mm. One final thing on that. Sorry, I know we're wrapping up, but the other thing is if funds are ever an issue, and this is for all women, but we
Mm.
know that doulas really have a positive influence over birth outcomes. And there are doulas that work and are paid by charities. So if that isn't
Oh,
ever an issue, I will send you over some details of that, Nicole, because I can't remember off the top of my head. I know one is neighbourhood doulas, but always look out for funding opportunities, because if you obviously it's really hard to advocate for yourself when you're in labour, and so get a doula. And if you can't afford to get a doula, look into ways of funding that through charitable donations for sure.
I didn't even know that was possible. I didn't even know
Yeah,
that was an option. And
yeah,
for those people
absolutely.
out there, what is a doula? I feel like
Yes.
you'd be able to neatly explain it better than I.
Yeah. So a doula is a trained birth worker, really. So they have had lots of training in how to support women during their motherhood journey. They're not a midwife; they don't practice clinical skills, but they are very, very skilled in supporting a woman's physiology. So often they will kind of be competent in massage, in hypnobirthing, sometimes in biomechanics, which is a way of kind
Oh,
of making space for the baby.
yeah.
Um, and often they're mothers themselves, but not always. And usually you have them from quite early on in your pregnancy. And so, again, you develop that continuity of carer relationship, and they can go into the hospital and advocate for you and say, right, is this what you want? That we talked about this antenatally. Are you happy for this? Yeah. So they have really good outcomes.
Okay. Okay. And then I guess my last final
Yeah.
question is, what is the one word or phrase that you would use to describe your motherhood journey to date?
Oh my gosh. Wow. Um, I think I'm gonna have to go with, oh, no, that's not powerful enough. I was going to say varied, Nicole, because it's just, I mean, squiggly is could not be better, could it?
Mm,
Squiggly could not be better, because it's all over the place all the time, massive highs and really lows as well. I think I'm gonna go, oh, uh, okay, I've got it. I'm gonna
okay.
go with exposing.
Okay.
Um, yeah, exposing in all ways. It exposes every part of you that you didn't know
Mm,
was there. Yeah.
yeah, I totally agree with that. Exposes the good, the bad, and the ugly.
100, that's it. Yeah, well done. You summed it up. That's it perfectly. Yeah.
Cool. And where can people find you if they would like to kind of look into your service a little bit more?
Yeah, so my website is mamasanctuary.co.uk, mama with one M, MAMA, or Instagram, mama_sanctuary is my Instagram. Just get in touch for a one-off appointment, for a free phone call, or for full care. I am here and I'd love to hear from you.
And we'll provide all the information again in the show notes as well, for anyone who's interested in connecting with you.
Thank you so much for having me. It's been just a joy to chat to you. I've loved it.
Yeah. Thank you so much.
Oh,
Thanks so much
thank
for
you.
being a guest.
Thanks again. Take
Cool.
care.
Bye.
Bye.
I went back to work after my maternity leave and I struggled. I struggled to go to work, to maintain a house, to cook, to clean, to look after two toddlers. It was just a lot. The mental load was insane. My to-do list was so long. And I was thinking, what can I do to make my life easier? What can I do to kind of outsource the stuff I have on my to-do list? And the first thing that came to mind was food. And so I turned to HelloFresh. I went online, I picked the recipes that I wanted, the ingredients was delivered straight to my door, and I was able to cook freshly cooked meals for my family in 30 to 40 minutes with the help of my daughter. And just like that, the mental load of having to cook, which I absolutely hated at that point, had completely gone in the bin. So, for all my listeners of the podcast, I'm giving you a discount for HelloFresh. So you have one less thing to think about. Go to my show notes, click on the link, and give yourself that discount of HelloFresh today. Remove that extra thing of your to-do list and make your mental load a lot lighter. Check out my show notes now.